To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're talking about acid reflux. We're going to give you some tips on how to take care of that. To help us through that is Dr. Jassim from Surgical Associates of Neenah. Welcome, doctor.
Thanks, Brian. Good morning. Thanks for having me.
I did want to talk about this because there is a lot of people that we have these little things that are coming up, acid reflux, but it could be more than that, right?
Right, absolutely. So acid reflux is a condition, it's also known as GERD, or Gastroesophageal Reflux Disease, where people get heartburn and regurgitation, okay? And so that usually happens because there's a valve that separates the esophagus from the stomach. That valve normally keeps things from coming upwards. If that valve weakens or the diaphragm itself weakens, then that can cause reflux. And reflux can lead to some significant problems, things like esophageal cancer, and esophageal cancer is a very, very deadly actor in the world of GI surgery. And so, you know, it's very important that people understand that it's a serious condition that can be treated with surgery or medication. If people fail medication therapy, then they should consider surgery.
How many people are affected by GERD, would you say?
Yeah, that's a good question. 1 in 5 patients take medications on a weekly basis, but we think that at least 1/3 of the population has GERD in the country.
So if I don't want to take medication my whole life or have those side effects from medication, what are the surgical options for it?
Yeah. So there's one option that has been around for a long time. It's called a fundoplication, but a newer option is called the LINX procedure. It's a little ring of magnetic beads that we can place laparoscopically, meaning through tiny little incisions, usually outpatient surgery. The LINX is a little ring of beads that then fits around the esophagus where the valve is located, and it helps to strengthen the valve that's already there. And it really helps with quality of life. People get off medications regularly with that procedure.
That kind of blew my mind, that you can do that. You think about technology.
Yeah.
So how long after the surgery till I don't have the acid reflux anymore?
We literally stop your medications that day.
Wow.
Yep. You don't need medications after.
You said it's outpatient recovery time?
Yeah, generally a couple weeks. You know, no heavy lifting, you know, some of the routine restrictions that you'd see with surgery. But usually a couple of weeks, but people have gone back to work usually within a few days sometimes if they're not doing any heavy lifting.
Let's then circle back and hit on very quickly some of the symptoms, because there might be people think, oh, this is no big deal.
Right.
But what are the warning signs?
Sure. 2 most common symptoms are heartburn and regurgitation, meaning you feel acid getting into your throat. If those symptoms are not managed on medication, those are reasons to consider surgery. If you have side effects or intolerance to the medications, that would be another indication to consider surgery, because you don't want to have reflux continue unabated.
Well, doctor, I want to thank you so much for walking us through this good information, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.